Providence nurses are now halfway through a 5-day planned strike at the Portland, Home Health and Hospice, and Seaside locations.
Yeah, they say they're paid below market value, but we wanted to know how much more money does Providence Health and Services have to pay them? Brendan Thompson reports.
To put it simply, Providence is not in the best financial situation right now. It lost more than $1.5 billion last year, but the nurses union says, hey, look at the executives. The CEO makes around $10 million, and there are several executives making 7 figures. The nurses say those aren't even the people keeping patients alive.
Hey, hey, ho, ho, unsafe staffing has got to go!
Nurses on the picket line for day 3. Before the strike began, Providence offered a contract that would increase pay $35 million in the first year compared to the last contract. But the Nurses Association says it did not pay all nurses at the same range and does not make up for paid sick time the hospital system had cut. Providence has over $26 billion in assets, but since the end of 2021, it has been in a precarious financial situation. Providence faced a $1.7 billion operations deficit last year, though there are signs the bleeding is slowing. Through the first quarter of last year, Providence was over $500 million short. Through the first quarter of this year, it's short $345 million. Revenues last year increased 8%, but pharmaceutical and medical equipment costs increased 13%. And labor costs were up 5% as the hospital relied more on contracts with staffing agencies versus staffing employees because of the labor shortage. The hospital system was not alone, as the Oregon Association of Hospitals and Health Systems report 63% of hospitals in the state are facing deficits in their operations.
When you see sustained losses like that over such an extended period of time, hospitals are really going to be forced to make difficult decisions.
The Oregon Nursing Association points to executive salaries as one area to fund the increased pay for nurses. CEO Rod Hochman leads all earners at Providence, according to several reports, with a salary between $9.5 and $10.5 million. The next highest earner makes around $3.5 million. Several reports tally there are between 19 to 26 executive employees making at least $1 million. Providence does not dispute these numbers. In a restructuring plan announced last summer, Providence says executive positions would be cut in order to focus on recruitment and retainment to limit the reliance on staffing agencies.
Because there is a nationwide workforce shortage, hospitals have had to rely on outside agencies to fill needed positions.
Providence did get back to us with more details about the restructuring plan. They're saying many of the executive positions are being cut after people either retire or leave voluntarily. We wanted to know, what's the difference between what a nurse on staff makes and a nurse in a staffing agency? Providence says that depends on the market and the demand, but nurses on the picket line say that nurses from staffing agencies or travel nurses make significantly more. A reminder, Providence does not negotiate during a strike, so nurses will be on the picket line through Friday. Reporting in Southwest Portland, Brendan Thompson, KOIN 6 News.